Recording in progress.
Good morning. Welcome to the WHO Africa Media briefing, which is taking place in collaboration with the APO Group. My name is Dr. Mary Steven. First, some housekeeping. You can listen to the media briefing today in 2 languages, French and English. Please go to the bottom right-hand corner of your screen and select your most preferred language. French, please.
Oui, bonjour à tous et bienvenue à cette conférence de l'OMS. Si vous souhaitez écouter la conférence en français, merci de cliquer sur l'icône en forme de globe située tout en bas de l'écran. Merci.
Merci, Khadija. Joining us now from Brazzaville, the Republic of Congo, is Dr. Richard Mihigo, who is our coordinator for immunization and vaccine development at the WHO Regional Office for Africa. And Dr. Mihigo will introduce our remaining panelists. Welcome, Dr. Mihigo.
Yeah, thank you very much, Dr. Mary. And good morning and good afternoon to all the journalists joining this press conference to discuss today the spread of Omicron variant, as well as the vaccine rollout on the continent. So I'm very pleased to be joined for this conversation by Dr. Christian Happy, who's a professor of molecular biology and genomics and director of African Center of Excellence for Genomics of Infectious Disease at the Redeemers University in Nigeria. He will present the latest findings on the variant in Nigeria. So we are in the second week since the identification of the Omicron variant by a stellar team of scientists in South Africa. The variant has now reached around 60 countries worldwide, 10 of which are in Africa. This continent currently accounts for 46% of nearly 1,000 cases of Omicron variant reported globally. There are now more than 8.8 million COVID-19 cases on the African continent, including over 220,000 deaths. Over the past week, new cases in Africa have risen by 93% compared with the week before. 3 sub-regions in the continent have reported an increase in cases. This is 2 more compared with the previous week. The Southern Africa region has recorded the highest increase with a weekly case rise of 140%, mainly due to an upsurge in South Africa. Researchers are working around the clock to determine whether Omicron, the new variant, is more contagious, causes more severe illness, or if it has any impact on vaccines and treatment. There is an assumption that the current vaccines may not protect people against Omicron. But so far, there is no conclusive evidence that vaccines are ineffective against this new variant. Vaccines have protected, as we know, people from severe disease and hospitalization due to the other variants of concern so far, and there's been no need to modify these vaccines. So encouragingly, emerging data from South Africa suggests that Omicron may cause less severe disease. Data which looked at hospitalization across the country between 14 November and 4th December found that ICU occupancy was only 6.3%, which is very low compared with the same period when South Africa was facing the peak, which was linked at that time to Delta variant, and I'm talking about July this year. So this is still a preliminary analysis, and we will need at least another 2 to 3 weeks to determine Omicron's full effects. In the meantime, WHO continues to support countries to improve genomic surveillance, to track the virus and detect other virus of concern. In South Africa, for example, a regional genomic sequencing laboratory is currently supporting 14 Southern African countries and has significantly scaled up sequencing activities. From around 5,000 samples sequenced in the first half of 2021, it now samples the same number, but every month. Really a big progress. But as countries grapple with the new variant and a rise in cases, Africans are yet to receive a single dose. So with millions still unvaccinated in this pandemic, we are giving the virus an easy path to spread, mutate, and potentially pose dangerous challenges ahead. Only 6 countries in Africa out of the 54 countries have reached the global target of vaccinating 40% of their population by the end of this year. Millions of people in our region are without protection against COVID-19. So this is simply dangerous and untenable. It is encouraging, however, that COVID-19 vaccine supply continues to pick up, with now more than 20 million vaccines arriving in Africa on a weekly basis. And we are coming from afar, nearly maybe 2 million in the last 5 to 6 months. So the continent has now received a total of 372 million vaccines, of which 248 million, or around 67, have been so far administered. Our job remains to support now African countries step up their vaccine absorption in the shortest amount of time possible. We must do whatever it takes to get countries to address bottlenecks in their COVID-19 vaccine rollouts. WHO experts are on the ground as we speak, supporting countries to develop or update their national vaccine deployment plans, the district's micro plans, as well as implementing innovative and agile vaccine delivery strategies and address misinformation on COVID-19 vaccine, which drives, unfortunately, vaccine hesitancy. WHO is conducting a close review of the findings of close to 24 interaction reviews that we conducted in several countries and 17 country mission reports, so that we can identify the cross-cutting lessons from these reports and apply them on the ground. We are closely following up with countries, monitoring developments in their vaccine rollout, and supporting them to continue to address the identified bottlenecks on an ongoing basis. We hope that these actions will continue and lead to a more equitable world where people can be with their family and loved one during particularly this festive season, which should be times of generosity of spirit and unity. So I look forward to our discussion today, and thank you again for joining us this morning. Pleasure now to introduce the next speaker, who is now going to provide the highlights from Nigeria. Over to you, Mary.
Thank you very much, Dr. Richard. And Professor Happy, Nigeria has detected the Omicron variants. Can you tell us how this will impact on the epidemic in Nigeria?
Thank you. We have detected Omicron variant, but at least as of today in country, it's just a handful. So it's really not a large number. But then the data collection and then analysis are ongoing both at NCDC and then also in my lab as I'm speaking. And we will be getting the data back to government, and then they can make a pronouncement to it. But as far as the epidemic trajectory in Nigeria is concerned, the data are made available on a daily basis. We haven't seen a surge So we've seen a little increase, in the past few days, and we really need time at this point to determine whether this is going to follow the trajectory that we observe in South Africa. Remember that even in the first and second and third wave, what we've seen, the trajectory of the epidemic in South Africa was very different in many other African countries. And we definitely understand that we need to continue to monitor, and we will definitely continue monitoring. We have data have been collected now, and then there is the consortium in Nigeria is on top of it. We will have more data coming downstream. But in addition to that, I just want to say that we are also in the African Center of Excellence for Genomic of Infectious Disease in collaboration with the CDC. As I'm speaking to you, Africa CDC, we have 16 different African countries in our lab training, and they're going back again to use the skills for genomic sequencing that they acquire in our lab to support, the response in their various countries. I just wanted to point out that we are not sitting back, we are very proactive. And then as a continent, we are very proactive. We have countries across the continent in our lab at the moment. And then we started the training on the 1st of December, and we'll be finishing on the 15th. And then they will just take this updated skill that they got back to their various countries to start generating the data that Africa needs in order to respond to the pandemic.
Thank you very much, Professor Happy. So now that you have heard from our panelists, journalists, it is your time to ask your questions. To do this, please use the Q&A function on the Zoom platform. Tell us your name, the name of the media organization you represent. And if you would like to ask your question live, please indicate in the Q&A. So in addition to our panelists, we have experts on hand to still answer your questions. This includes Dr. Tiano Balde, who is the incident manager for COVID-19 response here at the regional office. And we also have Dr. Nisi Umede, who is our regional virologist. So before we get additional questions, I would like to ask a question that was sent written. Please indicate if you would like to go live. So I start with this question. This question is coming to you, Dr. Tiano Balde. What do the latest figures and study in South Africa tell us about the severity of the Omicron variants? And how many of them are vaccinated and how many are unvaccinated? And Dr. Nixie, you will answer the second part of the question. If the Omicron had proven to have a higher transmissibility than Delta variant, but will cause milder disease, is it good news for the world? And is it a way of the world to exit the pandemic? Okay, Dr. Tiano, you answer the two questions, please.
Okay, thank you so much, Dr. Mary, and good morning, colleagues. I mean, we are really monitoring very closely the situation which is happening currently in South Africa over the past 3 weeks. And I can tell you over the past 7 days that we are seeing definitely a kind of major increase in the number of cases, almost a 255% of increase during the past 7 days in terms of the number of cases. And in terms of admissions in both public and also private hospitals, we are seeing also an increase in number of cases. And this is about almost 12% of increase when we look at the past 24 hours, that was as of yesterday. So definitely we are having more cases and also more people who have been admitted in the hospitals. But as Dr. Richard rightly mentioned, I mean, when we compare the situation of now with the Omicron in comparison to the Delta, definitely the number of admissions are quite very low. So, but also it's very important to mention we are really at the beginning, at the onset of this current fourth wave. So we might need to have a little bit more time. So just to go also more in details around, I mean, the hospitalization, when we see, I mean, the impact of the COVID-19 patient into the ICU capacities, which is quite a very important indicator, we have seen that currently in South Africa, only 6% of the ICU beds are currently occupied by COVID-19 patients. So there is still a kind of good margin within the health system, in South Africa, and especially in the Gauteng province, for really addressing those current and the changing needs. In terms of vaccination, I think it's quite early also to, we know that we have very limited data. We have really very preliminary information around, all of the patients who has been admitted. Most of them were quite younger people, and so probably also with a kind of a variability within, the vaccine status. But at the meantime, it's quite very important again to mention that we might need additional weeks to see exactly, the impact of the Omicron on the severity of the severity on this disease. And the other point about, I think, how can we feel about this in South Africa? Again, let's do not be over optimistic. We have to monitor the situation and to be, driven by the facts, by the figures, by the information that we are receiving, both from South Africa, but also from other neighboring countries also, where we know that the Omicron is circulating. Back to you, Mary. Thank you.
Thank you very much, Dr. Balde. Paul, I understand you would like to go live with your question. If you're ready, please go ahead. 1 to 2 questions only.
Yes, thank you very much. So my first question is for Dr. Mihigo regarding the issue of unused vaccines, especially in countries that have very wide margins, that are only using less than 10% of the total vaccines that they've used. So can we have an indication of how many doses have expired because these countries were not able to use it, and whether there is a new policy regarding the expiration date for those donation for donated vaccines for African countries to receive? And for Professor Api, I'd like to ask your thoughts regarding the capabilities of Africa's genomic surveillance ecosystem. What is the proportion of total samples collected that is required to be sequenced to have a clearer picture of what is happening? Because we have countries that, I think less than 5 countries in Africa have been able to provide sequences for samples that were collected in the last 15 days. So I want to know what needs to be done to quickly close this gap so that we can have a truer and more real-time picture of the situation regarding genomic surveillance. Thank you very much.
Okay, thank you, Paul. We start with you, Dr. Richard, and then Prof can come in with the question on the sequencing.
Yeah, thank you, Dr. Mary, and thanks, Paul, for this question. In general, when we looked at the supplies that have arrived on the African continent, I think particularly the last 4 to 6 weeks, we have seen an increased number of doses that have arrived. We've moved to a situation where we're receiving 2 to 3 million doses per week, towards a situation where we're receiving around 20 million doses per week. So when we're analyzing the data during this 4 to 6 weeks, in general, we have had between 60 to 80% of the doses that have arrived and that have been used. But cumulatively, when we looked at the data from all the 54 countries in the region, we have only I think 2 countries that are really very much lagging behind, less than 10% of their doses that they've been using so far. The vast majority of the country, more than half of the country, have used between 50 and more than 100% of the vaccine that they've received so far. Again, we need to take into consideration the increased number of doses that have been received, particularly the last 3 to 4 weeks. This is bringing the majority of the country now between the other parts between 50 and 40% and 30%. Now, in terms of the policy in using vaccine, we have issued a joint statement between WHO, UNICEF, Africa CDC, we as part of the COVAX, reiterating the needs for the donation to be for at least a very long period of time. We have seen the issues that have been created by the vaccines that are coming with a very short shelf lives, which tends to create or pose additional challenges to the country when it comes for the rollout of these vaccines. So we are, however, very much encouraged by the trends that we are now starting to see where the uptake of the vaccine, particularly during this Omicron period, many countries are really ramping up their vaccination drive. And those who are lagging behind, as I said in my introductory remarks, we are really focusing on them to make sure that they can support not only WHO, but also working with all the partners to make sure that we can provide targeted support to those countries.
Thank you very much, Dr. Richard. Professor Happy?
Yes, I just want to say that the question was to find out the capacity of Africa in terms of sequencing, the genomes. I want to say that the capacity, although not consistent in all countries, but it's very robust. You could see our colleagues in South Africa being on top and discovering this variant. And also to state that even within Nigeria and then most West African countries, there are several hubs of excellence in Ghana, in Senegal, and other places. What is beautiful about what is happening during this pandemic is that the strong cooperation among African countries, and we are collaborating and we are supporting other African countries. Now, you mentioned the fact that while we only about a few handful of countries in Africa have generated, updated sequence data. The truth of the matter is that you cannot generate the data that you don't have, in the sense that recently, in the case of Nigeria, we have been consistently sequencing, and most cases, they were negative even PCR tests in many states. We got to a very low level, and then now we started having this case. The few cases, and now we're actually also looking into it. You cannot just fabricate data. You have to generate, you have to show the data that you are producing. And if the data are coming out and then we can show that we have Omicron or we have other variants, we will share. The truth is the fact that, around, August, September, my lab is one of the lab testing in Nigeria. The number of cases, the number of positive cases from sample received were very, very low. And as such, you can produce genome from negative cases. Now that we have this, we're going to work, and then we're definitely going to be sharing the data as we generate them.
Thank you, Professor Happy. Nixie, do you want to weigh in on strengthening the capacity for sequencing in the region?
Yeah, thank you so much, Mary. I don't want to really take more time on this because Prof. Happy has just very well elaborated on the situation in Africa. So if we look at what it was before, like towards the end of 2020, we had quite a handful of countries or laboratories that were managing to produce the sequencing data. Today, the countries that are having their own sequencing data, they are close to 50. So it shows that there is quite a very robust system that has been really initiated by Africa. And remember that at the beginning of the pandemic last year, Africa CDC, together with World Health Organization, they came together to collaborate and form a very strong network for COVID sequencing laboratory. Prof. Happy is one of our specialized referencing laboratory that are supporting the lab. As he was mentioning earlier on, that he's busy training some of the countries. So with that, we can really say that the number of cases or number of sequencing data that was produced by the end of 2020, they were close to 4,000. As we are speaking to you now, I think the entire region is producing close to 70,000 sequencing data that has been reported into one of the platforms that are publicly published globally. So that is an indication that really the region is upping up or is upping the scaling of the sequencing in a very aggressive way to support what is happening currently. Thank you, Mary.
Thank you very much, Dr. Nixie. And this question is coming to you, Dr. Richard. The question is coming from Aena from Reuters. The Serum Institute appears to be cutting vaccine outputs because of slowing demand from COVAX. Are there adequate flows to COVAX? Are the shots from serum now being replaced by donation? And then the second part of the question is, what is being done to help countries overcome the challenges of deploying the shots? Given the level of uptake, at what point would you recommend vaccine mandates? What is the alternative to a mandate?
Okay, thank you, Dr. Mary. These are quite very good question. On the first question on the Serum Institute of India, maybe we need to clarify things here and put the facts into perspective. You remember that after the occurrence of the Delta variants in April, May this year, the Serum Institute of India suspended all the export of vaccines to COVAX, but also broadly, which created a lot of course, issues in this region, particularly that many countries were expecting to receive the vaccine through the COVAX mechanism. And some countries even left without having provision of a second dose. So the reality is that in the first place, the supply was stopped by the Serum Institute of India at that time. So more recently, indeed, we heard the good announcement of a restart of this exportation. But as we know, the issue is not necessarily COVAX alone. I think in the meantime, countries move on, looked for alternative to find their solution, to get a bit more supply. And if we looked at the current pipeline in the COVAX forecasts, I think the pipeline is quite very promising. We are expecting to receive between 800 million to almost 1 billion doses through COVAX. And this number is going probably to double next year. So the issue today is not the lack of demand through COVAX. I think we have now enough product, enough vaccines that are going to come through the COVAX mechanism. So what we need to do really now is probably the second part of the question, the challenge in deploying these vaccines. And I think, as I've said before, we are doing whatever it takes, not only WHO, but also many other partners, working with our colleague at Africa CDC, working with UNICEF and countries themselves to see how the bottlenecks that are hampering the delivering of the vaccine can be really resolved. So we've deployed different surge missions in countries that are lagging behind to try really to pinpoint all the small issues that our country are facing. So we do hope that we are going to get to a situation where countries are going to accelerate their pace in terms of vaccine deployment. And then finally, on the issue of vaccine mandates, I think WHO has been very clear on this since the beginning. I think one of the priority was, first of all, to make sure that there is enough supply, there is enough vaccine to make sure that everybody who needs a vaccine can get a vaccination. So the issue was not only to get the supply right, but also to increase the vaccination opportunities. Because sometimes even if the vaccine are present in a country, getting them through the delivery system in the country, we're creating a problem. So I think we believe that the first step to do is to make sure that we need to have the vaccine. We need to increase the vaccination opportunities. And then the country can now balance these type of measure, starting by this incentive to get people get vaccinated, but also a good explanation on the benefit of vaccination, and then ultimately to move towards some of these coercive measures. But really we are advocating more on this comprehensive approach to get as many people as possible there to vaccination before getting to such mandatory sort of approach.
Thank you, Dr. Richard. Leon from Daily Nation, are you ready to ask your question?
Hello, My name is Leon Lidigu from Daily Nation in Nairobi. Now, I have a number of questions. The first one is Canada this week announced that it wants the Southern African countries to do PCR tests in third-party countries like Kenya, for example, before being allowed to travel to those countries. So I want to know what is WHO's position on this, considering that these countries are also struggling to test people and do genomic sequencing due to the Omicron variant at the airports. And then WHO also contested this. And then my second question concerns Pfizer. Now, Western media and even Pfizer itself reports that now 4 doses of Pfizer will be needed to deal with the Omicron variant. How will this affect our drive as a continent, considering the fact that President Biden, Dr. Fauci, and other key figures are actually pushing for that? And if you remember, Dr. Tedros placed a moratorium on boosters. So what happens to also those who have already received the 2 doses? Will the WHO be joining the boosters bandwagon, considering the fact that now Pfizer is announcing that we actually need 4 doses? And then finally, Juba in July donated 72,000 AstraZeneca doses to Kenya because it couldn't execute a rollout of the jabs. And then we saw the European Union provide funding to UNICEF to strengthen the rollout in Southern Sudan. But according to WHO, what is the current situation there? Thank you.
Okay, thank you very much, Leon. Your first question will be answered by Dr. Tiano Balde, and then the second and third question will be answered by Dr. Richard on the vaccine mandate and the issue of South Sudan. So Dr. Balde, do you want to comment on the issue of test requirement by Canada from Nairobi?
Yeah, thank you, Dr. Mary. I think if you put these different points, really in perspective, given the evolution of the situation, when the Omicron was detected, we saw this imposition of a blanket travel ban, to different countries. And definitely the WHO stands really against such practice and encourage more countries, on applying, the international health regulation, procedures, and especially by implementing some of the scientific and evidence-based intervention, at the point of entries. And we are seeing a much more movement from different countries in adopting those approaches. Risk-based approaches, and also and in order to protect their population. What is quite very important here, it's as long as all of different procedures somehow really are evidence-based, supported by evidence-based information, scientific information, and following also some of the ethical rules, I think this could be really quite well aligned with the WHO positions. Now, for the information from Canada, as far as I'm concerned, as far as I know that definitely there have been some changes in the entry obligations, from people coming from different countries, and the testing, obviously before traveling, it's one of them. Realizing the PCR test before traveling, and obviously once you are arriving also from some of the countries, you might be also obliged to make some of the quarantine and to take additional tests a few days after in Canada. But in overall, without going too much specifically for Canada, but also to other countries, it's very important that mentioned that the WHO is really recommending the implementation of scientific, rational, and evidence-based measures at all of the main different entry points. And this might evolve also, given all what we have been learning so far, on the severity and the transmissibility of the disease. And as a last point, we are seeing also really many countries, including the United States, really trying to reconsider some of the decisions that they have taken, previously, probably under the emotions or under the situation, the uncertainty of the situation. But we do hope that this situation might evolve over the time. So thank you, and back to you, Mary.
Thank you very much, Dr.
Mary, if I could say something here, I'm speaking.
Hold on. Let's answer your question first. Dr. Richard, do you want to answer? Hold on, I'll come back to you. Let's answer the question.
No, thank you. I'm sure Prof, will add something on. I think on the first point, just if I can say two words on that. I think African countries, and particularly South Africa, has shown that in terms of leading in science, I think there is no lesson that could be really be given from outside. I think we have very competent scientists in this continent. I think countries are doing a very great job in terms of detecting the cases. So I think WHO, as you said, I think we've really condemned such measures because it's adding discrimination to a situation that is already tense. Now, with regards to the Pfizer vaccine recommending a fourth dose, I think let's be a bit more cautious about that. There is no, so far, formal communication on that. What we are following up now is to see exactly what will be the true performance of the existing WHO UL vaccine on Omicron. In the past, we have seen that with the variant of concern, there was no need to change the formulation of the vaccine. The vaccines that have been so far, WHO UL have been providing quite a very, very good protection on severe disease and hospitalization, which are mainly the major output that we are looking for vaccination. Now, with Omicron, it might be too early to start concluding about the performance of the vaccine itself and an additional need for a fourth dose. I think our position has been that let's wait to see the evidence that are emerging, and then our country can be advised accordingly. Now, with regards to the booster dose and the moratorium that WHO requested for that, I think we are still really on the same position. I think we have seen the number of supply increasing, that's true. But I think we need absolutely to continue to in that direction so that the high-risk population, the people who are really in great needs of vaccination, can get those primary series of vaccination everywhere as the situation is going to be improved. And WHO has been very clear that even for some subgroup of the population, like people who are immunocompromised, some elderly people with severe precondition, I think the administration of a booster could add some benefits to those subpopulation. But there was very little benefits of a booster dose for the younger population so far. But again, as I said, we are following quite very closely the situation with this Omicron emergence. And as science, as data are going to be released, definitely we are going to adjust our recommendation. 2 days ago, the Strategic Advisory Group of Experts on Immunization, the SAGE, met in Geneva and looked at the issue of additional doses, including booster dose, and again, reiterated the need to continue to focus and target to the high-risk group, while at the same time, indeed, offering additional doses to those who are more at risk or immunocompromised. And then finally, on the situation of South Sudan, we had a team which was on the ground in South Sudan a few weeks ago. Indeed, the country was having some issues in deploying the vaccine, but we were able to work with the government of South Sudan, including the in-country partners, to provide additional support to South Sudan to increase their absorption capacity, including the implementation of campaign mode to accelerate the vaccine rollout in that particular country. So we are hoping that, and we are seeing a very good positive sign that the recommendation, the actions that were actually discussed in Juba a few weeks ago are now starting to yield some positive remarks. But we are going to continue to monitor this South Sudan is part of our watch list where we are doing almost a daily monitoring. Over to you.
Thank you, Dr. Richard. Leon, you had something before I interrupted you.
No, I was the one speaking at the time.
Oh, okay, is it Prof?
Yes, I was the one trying to speak.
Yes, it's okay. Go ahead, Prof.
Yeah, I was trying to be very specific to the testing in the third-party countries by Canada because Dr. Tenobalde tried to address it. But I want to speak as a scientist, so not as a diplomat. And I wanted to make it very clear that that is not only discriminatory, but it's ridiculous. Because if Canada is accepting the existence of Omicron, you know, detected and sequenced in South Africa, then it's ridiculous for them not to accept, you know, testing from those countries. If Canada is accepting Omicron, you know, from African countries, and then they are rejecting tests from those countries, it is not only discriminatory, but it's very ridiculous. Thank you.
Thank you for that addition. And the next question is coming from Tuluase from the Punch newspaper in Nigeria. It's back to you again, Prof. We are aware of the good works that are being done by Professor Happy and his team. So is it possible that your center has discovered the Omicron variant before the Nigeria CDC made the announcement? Then the second part will be answered by Dr. Richard. Nigeria has not commenced the rollout of the J&J vaccine because of concerns with blood clots. Should countries suspend the rollout of J&J? So I start with you, Prof, and then Dr. Richard.
Yeah, I want to make it very clear that the first cases of Omicron in Nigeria were confirmed and then sequenced by the NCDC. And we, in our lab, did not detect anything before then. So I think I want to make it very clear that that is the case. But again, you know, it is very possible that if some samples that were collected way earlier get sent to labs now, and then you do a retrospective analysis, it is a possibility. Again, I say it is a possibility, but then so far, there is nothing beyond what the Nigeria Center's NCDC has presented. Thank you.
Thank you, Prof. Dr. Richard, please.
Yeah, no, thank you. Yeah, thank you, Dr. Mary. I think the first thing I would like to say is now we've close to more than 8 billion doses of vaccine, COVID-19 vaccine that have been deployed globally. And a robust monitoring of adverse event that has been put in place, not only globally, but also in our country. We have now a clear idea on the safety of these vaccine. And we have a very, very strong and robust safety track for most of the vaccines, particularly those who have received the WHO emergency use listing authorization. So we have not received any complaint in that regard from Nigeria. I think the country has planned clearly their vaccination drive based indeed on the vaccine that are arriving with a short expiry date that they want to deploy very quickly, as opposed to the vaccine that have got a much more longer shelf life. And I think this is a very good strategy to implement. So we are working quite very closely with the Nigeria Federal Ministry of Health, and we have not heard any concern about that.
Thank you very much, Dr. Richard. Kerry from Health Policy, are you ready with your question?
Yes, I'm ready. Thank you, Dr. Mary. It's related to the travel ban. The whole of Southern Africa seems to have been slapped with the travel ban, but I think that there are some countries in Southern Africa that have not even identified Omicron. I wondered whether you could confirm whether this is true or not, and just say which of the countries don't have Omicron but have been affected by the travel ban. Thank you.
Okay, so I pass your question to Dr. Baude, and then Dr. Nixie could complement on which of those haven't reported the new variants. Dr. Baude, please.
Thank you, Mary. As of 2 days ago, there was almost 11 countries, in the African region, which have really reported the presence of the Omicron. But definitely, there's no direct correlation, between those countries, the number of the countries, and also the imposition of the travel ban. As I mentioned earlier, the travel ban, this blanket travel ban, was really imposed to countries just a few days after the announcement of South Africa, without any really major, proof or really information indicating that the Omicron was circulating. It was about 8 to 9 countries in Southern Africa which were targeted by most of the countries, especially from the Western, from the Western world. So there was not really that clear correlation. So just bringing back again, this issue about the imposition of the blanket travel ban, on which definitely WHO stands, for with African nations, to mention that these are not really very effective, are not effective for really limiting the transmission of the Omicron. And today we can see it almost, the Omicron has been detected in more than 50 countries across the world. The circulation, there are some local circulation of the Omicron. So definitely there's no really scientific and evidence-based reason, for really imposing these blanket travel ban. At this point, I think what is really important is to review these measures which has been imposed, and to take the most appropriate measures, knowing that this might also have a major consequence, because it can really discourage many countries for sharing additional information on these kind of public health, global public health threats. So thank you, and back to you, Mary.
Thank you, Dr. Baude. Dr. Nixie, do you want to confirm that all Southern African countries have reported or not the new variants?
Okay, no, it's only 5 or 4, to be quite honest with you, that have officially reported the Omicron. The rest of the southern countries, they have not reported. So just to put it in blindly, is that Botswana, South Africa, Zambia, Namibia, they've officially, and even the government have declared the presence of the Omicron in their country. We are following up with the Zimbabwe, of which we had sort of like a story that there might be an Omicron that has been reported to that. So once you've got a declaration from the government and being confirmed, then you can really state it openly that also Zimbabwe is part of that. So you can see that out of close to about 14 countries in the southern part of the region, it's only 4 or 5 of the countries that have come up and say that they do have the Omicron being reported from them. So the rest have not. Over.
Okay, thank you very much, Dr. Nixie. So this next question is coming from Michael from Future News. I'll start with you, Dr. Baude. We understand South African hospital wards are jammed with patients with the new variants. What is the situation right now on ground? And then the second part of the question is to you, Dr. Nixie. Is Africa ready to take on the new variants like Omicron? We understand it is quite expensive to sequence the DNA of various variants, including Omicron. Does Africa have the resources to do this? As we know, it is still struggling to get supplies like oxygen, ICU beds, and PPE. So let's start with you, Dr. Baude, on the situation of hospitals being full with new variant cases in South Africa.
Thanks, Mary. Just to avoid, any confusion based on the figures which were just mentioned now, I was mentioning 11 countries. This is for the entire continent of Africa, which has reported Omicron. And the Nixie was referring to the countries in Southern Africa, the 5 or 6. So that was just a kind of clarification I wanted to bring here. And on the situation for South Africa, I think we have really mentioned it, and we are really monitoring the situation on a daily basis from the WHO side, but obviously from also the National Health Authority communities in South Africa. And based on the information that has been shared at the moment, yes, we are seeing this increasing number of the admission, but we cannot say that there is a major tension currently in South African, hospital, and especially in the Gauteng province. Definitely there is around 6% of the ICU beds, as I was mentioning before, which are mainly occupied by the COVID-19 patients. So there is still a large margin of capacities into the hospitals in South Africa, which can really take care of the COVID-19 patient, which might happen, in the upcoming weeks or might not, so given, the evolution of the trend. So this is what we can say at the moment, but definitely there is kind of, a good, capacity at the moment in the country, and we are continuing monitoring the situation and providing all of the necessary support if ever needed. Thank you, and back to you, Mary.
Thank you, Dr. Balde. And Dr. Nixie, the second part of the question, please.
Africa is more than ready to tackle the Omicron. We can say it boldly that Africa is more than ready to do that. I think I'm going to refer back to the statement that was mentioned by Dr. Richard at the beginning, where he started stating that we were looking at about 5,000 cases that were reported by the entire region in terms of reporting the sequencing data. Whereas we are now seeing that coming up almost on a monthly basis. So meaning that the Africa has really grown so much when it comes to the sequencing activities. And then when we link that to what WHO has been doing in trying to support the countries in scaling up the genomic surveillance on the continent, we are seeing a lot of support coming from WHO to the countries. Most of it is in terms of the funding. There's a lot of money that has been sent to the countries that are now experiencing the outbreak of this Omicron. We are also seeing WHO as an office sending up the teams to work with these countries to see how they can support the countries for them to be able to respond to this outbreak of the Omicron. And of course, for those countries that are not having their sequencing capacity, as WHO, we are encouraging those countries to send whatever that has been coming up from their PCR screening, which is more like a target failure or is used as a marker to say this might be a possible Omicron, for them to urgently prioritize those viruses or those samples to be sent to their assigned sequencing laboratory. So we are more than ready. And then I think we are even ready for the next pandemic to hit the continent. Over.
Okay, thank you, Dr. Nixie. Eniola, are you ready with your question?
Yes, good morning. My question is on a report by Reuters news agency that 1 million doses of the COVID vaccines expired in Nigeria last month. The government says most of these vaccines came with a short shelf life, and so they couldn't roll them out on time. There are also fears that more doses may expire in the coming weeks. I just want to ask, probably Dr. Mihigo can answer this question. Shouldn't countries that cannot use vaccines with short shelf life, shouldn't they return them so that they at least redistributed to other countries that have the capacity to roll them out on time? I recall that some months ago, DR Congo did that, and vaccines were redistributed to other African countries that were able to roll them out at a short notice. So what is the protocol exactly? Aren't countries that can't distribute their vaccines on time, aren't they supposed to quickly return them or send or redistribute them? That is my question. I just want to know the protocol. Thank you.
Okay, so Dr. Richard, I will let you start with this question, and Professor Happy, if you want to complement after Dr. Richard, please. Dr. Richard.
Yeah, no, thank you, Dr. Mary. Yeah, we all follow the communique from the Reuters agency, but also we were in discussion with the National Authority in Nigeria, and we do currently have even a team down in Nigeria on the ground. If we looked carefully to the press release that was sent yesterday by the Federal Minister of Health, they are indeed stating the fact that the country will not, first thank the donation that are arriving in the country, but secondly, requesting that countries that are donating vaccine do that with vaccine that have got a much more longer expiry dates. And as I said before, we have issued ourselves with Africa CDC as well, a strong statement going into that direction, recognizing the indeed the generosity of countries that are donating vaccine to some of our member states, but also stating quite firmly that it's very important that this donation come with enough shelf life so that country can plan and deploy this vaccine without any problem. Now, going back to the situation in Nigeria in particular, we have learned that the country have now started a new strategy to really, as they say, put vaccines out in different settings to make sure that the almost close to 10 million doses that the country have received and which has been in majority being deployed is going to be accelerated. Now, in terms of the protocol you've mentioned, we have clearly monitoring the expiry date of this vaccine in each of the country. And when we have some red flags or a signal that in a particular country, some vaccine may be put at risk, we immediately worked with other countries to redeploy those vaccines where they can be used quite efficiently. But the good news is that we are not seeing this situation anymore as it was the case in the past, because most of the country we heard the situation in South Sudan, in DRC, but we are seeing less and less this situation because of the now readiness that has improved considerably in all the countries and a clear planning to avoid such situation.
Thank you, Dr. Richard. Professor Happy, do you want to weigh in on this?
No, I have nothing to add. I think Dr. Richard has addressed the issue squarely.
Okay. Thank you very much, Dr. Richard and Professor Happy. So this question is coming to you, Dr. Balde and Dr. Richard. Please respond in French. It's coming from Umaru from RFI in Dakar. At the Peace and Security Forum in Dakar, the South African President Cyril Ramaphosa was outraged by the border closure, even though his country did an excellent work in identifying and reporting this new variant. So Dr. Balde, if you can comment on this, and then Dr. Richard, the South African president also deplored that Africa faces the authorization issues despite its intention to produce vaccine. Can you comment on this? So let's start with you, Dr. Balde, and then Dr. Richard.
Oui, merci beaucoup. Oui, je pense que c'est une très, très bonne remarque que vous faites là et je crois qu'on l'a dit et on l'a mentionné encore. La déclaration du président Ramaphosa, donc indiquant un peu l'impact un peu de ces décisions qui ont été prises, de pouvoir empêcher les personnes donc de voyager à partir et pour l'Afrique du Sud, c'est quelque chose de totalement inadmissible et qui ne suit aucune logique scientifique, aucune logique rationnelle. On l'a mentionné plusieurs fois, nous saluons véritablement donc les efforts des scientifiques, la communauté scientifique sud-africaine qui a réussi à détecter ce variant-là, mais aussi et surtout partager cette information à temps avec le reste de la communauté scientifique mondiale, parce qu'une fois de plus, il s'agit de dangers de santé publique à portée mondiale. Donc, le plus tôt on est au courant, le mieux c'est pour pouvoir nous protéger. Donc, c'est une décision que nous saluons de la part donc, des politiques, mais aussi de la part, donc ça s'est tenu au niveau du forum de Dakar avec le président aussi à Sall. Donc, c'est deux événements qui sont importants et que définitivement l'OMS, le bureau régional de l'OMS ici, encourage à faire. Donc, nous continuons ces efforts-là à travers donc, certaines organisations organisation aussi sous-régionale comme la nôtre ici, avec une dimension un peu plus politique, pour voir quel type de position est-ce que l'on devrait arriver donc à prendre les pouvoirs, surtout prévenir ce genre d'événements, que ce genre d'événements ne se reproduisent pas dans l'avenir. Donc, au cas où il y aurait de nouveaux variants, qu'est-ce que nous pouvons faire? Donc, cette réflexion-là, on l'a initiée, on l'a entamée, on va aller de l'avant pour que l'on puisse avoir donc des décisions harmonisées et que les pays qui prennent ces décisions-là, par exemple, d'interdire ces voyages, puissent donc revenir sur ce type de décision-là maintenant et pour l'avenir. Parce qu'une fois de plus, il y a des effets très, très, très importants, des effets délétères qui sont très importants, qui sont donc le découragement, le manque d'incitatif aux autres pays pour pouvoir partager ces informations-là en tant qu'il peut constituer, chose qui peut constituer un risque majeur pour la santé publique mondiale. Donc voilà, merci et à vous, Dr. Migo, pour la suite.
Merci beaucoup, Dr. Baude. Dr. Richard, please.
Oui, merci, docteur Mary. La problématique sur le partage de la propriété intellectuelle, mais également le brevet, le transfert des technologies pour favoriser la production locale des vaccins, mais également de certains thérapeutiques, a été au centre, je pense, des discussions depuis le début de cette pandémie. Ce qu'il faudra qu'on retienne, c'est que l'Afrique est quasiment dépendant à 100% de tous les vaccins qui viennent de l'extérieur. Nous ne produisons quasiment pas de vaccins au niveau de la région africaine. Et je pense que cette pandémie a été une opportunité d'un réveil des autorités politiques, mais également des scientifiques pour voir comment créer une force de production des vaccins au niveau local. Mais dans une situation de pandémie comme nous la vivons actuellement, il est important que le transfert des technologies puisse se faire très rapidement, mais également que certains producteurs puissent accepter de partager les brevets pour que cette production soit faite localement et rapidement afin de sauver le maximum des vies au niveau du continent africain. Mais il faut dire qu'il y a un espoir parce que nous voyons que de plus en plus de pays ne sont plus fortement opposés à cette notion de partage de propriété intellectuelle ou des droits liés à la propriété intellectuelle. Le transfert des technologies commence à avancer dans le bon sens au niveau de la région africaine et notamment en Afrique du Sud avec le premier hub sur le transfert des technologies pour la production de vaccins en Afrique qui a été inauguré en Afrique du Sud. Nous voyons le Sénégal et le Rwanda qui également vont commencer bientôt à fabriquer des vaccins grâce à ce mécanisme de transfert des technologies. Donc, l'avenir, certainement, nous le dira, mais je pense que après cette pandémie de COVID-19, il faudra que les choses changent sur le continent, que nous puissions peut-être renforcer les capacités locales de recherche et de développement, mais également créer de partenariats solides pour être sûr que nous pourrons à l'avenir faire la production localement en cas de pandémie future.
Thank you very much, Dr. Richard. Professor Happy, before you leave, if you're still there, can you please respond to this question? Looking at the article in Nature last week, the research indicated that people with HIV are both more likely to die from COVID, and COVID is more likely to mutate among people living with HIV. What are the implications for countries with high HIV infection rates? The risk of drawing attention to these links is that people with HIV/AIDS will be further stigmatized. How can this be managed? If you can answer, and Dr. Nixie could complement this.
Well, I don't think that it is about stigmatization. I think what we need to do is actually to encourage as much as possible people with HIV, not only people with HIV. Actually, we're talking about every individual that is immunocompromised. I think we shouldn't single out HIV people. People that are immunocompromised by one disease or the other really present that risk. And simply because, as you understand, they are immunocompromised, and that gives room to the virus to just to grow almost freely. And it's in that process that you see all these mutations. So I think, we should encourage as much as possible and then make sure that, vaccines, are out there, are rolled out, and then we should reach out to the largest number of people as possible. And I guess, if we keep having this transmission going on, we will even have a situation whereby, yes, people that are immunocompromised present a greater risk. But as we've said before, as long as transmission is going on, then the potential to actually having new variant arising is still, is there. So the key is actually vaccinate, and then ensure that, we can reduce, we apply the safety and then the necessary safety measures, social distancing, wearing our mask and everything. Being vaccinated shouldn't prevent us from continuing to wearing our mask, and then ensure that we respect, physical distancing in meetings, and then avoid, as large gathering as much as possible. I think that is a lesson. The solution to this pandemic is with each and every one of us, not only with the WHO or the Africa CDC or the Global Health Organization or the countries. Each citizen should be responsible, and if we all act responsibly, we'll be able to curb this pandemic.
Thank you very much, Professor Happy, and thank you for your time on the press briefing today. We sincerely appreciate it. And then we now go to Sarah Javin for your question, please.
Thank you so much. So the head of the Serum Institute of India is quoted in the UK's The Times as saying, quote, "Everywhere I hear the World Health Organization and others talking about vaccine inequality, but the African nations are refusing to place orders. We've barely got 20 million doses worth of orders from the African nations. They're going very slow, claiming that they're waiting for donations from the US and others. So there's a bit of a disconnect," end quote. Can you please respond to this commentary? And then can you also clarify what he might mean by African nations placing orders? Because aren't the orders coming through COVAX and not bilaterally through deals with nations and the Serum Institute? Thank you.
Thank you, Sarah. Dr. Mihigo, please.
Yeah, I think it's very important to clarify such statement, which is not accurate. In the first place, there is no countries that is for the moment placing a specific or individual order to Serum Institute of India. I think most of the vaccine were expected to come through the COVAX, and the COVAX was doing a pool procurement on behalf of many countries in this region. We had also the African Union-led initiative, the AVAT, that also was doing a pool procurement on behalf also of the African countries. And you know that at one point, the AVAT has to stop negotiation with Serum Institute of India because of a challenge in terms of negotiation. So I think in the first place, as I said before, the export from India stopped sometime in April, May, and it was only resumed a few weeks later. So I think we cannot support such statement. I think today, most of the vaccine that are arriving are coming through COVAX, and COVAX has continued, as well as AVAT, by the way, to negotiate vaccine under that pool procurement system. So I think this is the comment that I can say for the moment.
Okay, thank you very much, Dr. Richard. This question is also coming back to you. It's from Lucia Blanco from Spanish International News Agency. As you said, during the last weeks, the arrival of vaccines to the continent has increased. Do you have specific data or percentages on this? Which one are those two countries lagging behind in terms of using the vaccines they received? Dr. Richard, please.
Okay, yeah, indeed, the vaccine are increasing. So we have statistics on that. As I said at my opening remarks, I think we are having now around 20 million doses that are arriving per week, compared to a situation where at the beginning we had around 2 to 3 million doses that were arriving per week. I think this is really a major jump in the right direction. We are even estimating that we're going to get even more vaccine, particularly before the end of the year and then the first quarter of 2022. What is important here to mention is that through at least the COVAX facility as well, a new system is going to be put in place where the country have been requested to provide their preference, first of all, their product preference, but also the quantity of the vaccine that the country could potentially absorb. So we're moving really from a situation where we have a push mechanism really to go towards a system where we are going to have a pull mechanism. And that will really help a lot to increase the visibility in terms of the number of doses that are going to go to the countries and the predictability in terms of the utilization, because this has been one of the major issues in the past, not knowing exactly how many doses are going to come, when those doses are going to arrive, what is the expire date of these doses. Such information most of the time was received by many countries like in few days before the shipment has to be made. But now the new approach of having a bit more predictability, having a pull mechanism is going definitely to help countries to plan ahead, to know how many doses are arriving, how many doses are going to expire and when. And we hope that will improve a lot the planning and the deployment process. Now, in terms of the countries that are lagging behind, I think we have a handful of countries that are indeed, so far we're not doing quite very well. The Democratic Republic of Congo, Chad, Djibouti, and etc. So these are the countries that we are working with to make sure that we can increase the capacity in those countries to make sure that the vaccine rollout is going to move in the right direction.
Thank you very much, Dr. Richard. The next question is coming to you, Dr. Tiano Balde. And this question is coming from Sho from NHK, Japan Broadcasting Corporation. You mentioned that early data suggests that Omicron is less severe. Can I understand that it kills less? Also, can you comment about the reports that young children are getting hospitalized in South Africa? Dr. Balde, please.
Yeah, thank you. I think we really need to be very cautious, with these assertions, and we are really at a very preliminary stage of these, wave, which has been, which is produced by the Omicron. So at the moment, we cannot take any major conclusion, around both the severity, but also really the demography, the demographic characteristic of the people who are mostly affected by the Omicron. At the moment, what we are really observing again, in South Africa, it's really some people who have been getting sick, but who have been also admitted into the ICUs, and we know that there is a certain level of capacity. We know also that the Omicron is quite spreading quite very fast, but when we compare the situation to the previous wave, the third wave, really driven by the Delta one, we are not seeing the same picture. It's not the same thing that we are really seeing. So, but more information, more data is really needed before getting to any type of conclusion. About, the youngness of the people who have been affected, there was this eclosion of cases, in some of the academic institutions, so given different factors. So that might be one of the element mentioning, that remark. But at this point, again, we really need to have more time to analyze more the information. And the science, we really build the science on the observation, and observation will require some kind of time. There is a time for which, we really need to take on and before drawing solid and bold conclusion around these different elements. So we are reporting what we are observing at the moment, but as the time is going, we'll be able, to draw more solid scientific conclusion around, the consequences of the Omicron. Thank you, Mary.
Thank you, Dr. Balde. And on similar notes, Dr. Richard, this question is from Lindsay from New York Times. With early reports of increased infection among children with Omicron variant in South Africa, will WHO Africa issue any specific caution or encourage vaccination for children under the age of 12 in other African countries?
Okay, no, thank you for this question. It's true that when we looked at the epidemiology, as my colleagues have said, more younger people are now starting to get infected. But with regards to vaccination, particularly with the young population, I think I would like to reiterate the WHO position, as we've been consistently saying that the priority for the moment really is to make sure that we can start first covering with the available resources that we have, the population that are more susceptible to get a severe disease and unfortunately die with this disease. We have seen cases of COVID in children, in adolescents, but which are usually of a mild nature. But I think for those children, and particularly we have seen few countries in the region, and WHO have made that quite very clear that for some of the adolescents who have a precondition that could expose them to severe diseases, I think they can get the vaccine because there have been now a pre-qualification of the Pfizer vaccine to that particular age group. But for those who are less than 5 years, I think so far we are not recommending this vaccination. We want really to make sure that the focus is really on the people who are more at risk and who are more keen to develop severe disease and unfortunately die with this disease.
Thank you very much, Dr. Richard. Then we have another question on the vaccines again from VOA News. Pfizer studies indicate boosters might be effective in neutralizing the Omicron variant. Could this encourage the hoarding of vaccines by rich countries? Back to you, Dr. Amihigo, please.
Yeah, if we looked at the data today, we are seeing that even before Omicron, we have seen that the high-income country are administering more booster doses than even vaccines that are being given in developing countries. Those I'm talking about the primary series. It's clear that if we are not careful enough, and this is the reason exactly of the WHO moratorium on the booster dose, I think there could be a potential diversion of some of these doses to continue with booster dose on the expense of the people who need them in developing countries. But as the vaccine supply is improving, and I think we need to be very careful on that, in improving in particularly this region. So we need absolutely to focus our attention to continue to expand the coverage to the population in the region first with the primary series. Remember that we have only 8% of the people who have been fully vaccinated in this region. This represents around 108 million people in a continent of 1.3 billion. So we should not lose focus and I think make sure that the remaining people who need vaccine gets the jabs, while of course working to improve the delivery, to improve the acceptance of the vaccine moving forward.
Thank you very much, Dr. Richard. We are now coming to the end of this press briefing. I will turn back to you. Professor Happy unfortunately had to leave for another meeting. So Dr. Richard, please, your final statement.
Yeah, no, thank you. Yeah, my first set is really to thank Professor Happy, who has to leave very quickly for another meeting. I think we have here from him a very good insight of the work that is currently being done on the ground. I would like also to thank all the journalists really who have been consistent in attending these weekly press briefing. I think we do value your contribution in sharing the right information to the large public. I would also like to thank the colleagues, my other colleagues who have been also providing additional information. So to say that as we are evolving in this new and closer to enter the festive season, it's very, very important that we continue to put in place or even to strengthen the public health measure and social measure that have been so far proven really to protect not only individual but our own communities against this variant. We understand that it's been a long period that people are battling with this disease. There is fatigue that are starting to get there, but we cannot afford, particularly at this period, to put down our guards. So our really message is to continue to implement the public health measure, social measure that have been in place so far. Secondly, I think as we are getting more information and data are emerging on Omicron, we will continue to update the general public and provide clarification and support to member states in this region in fighting this new wave. We have been through this process for almost 2 years now. Countries have shown a lot of resilience in fighting the pandemic. We are expecting to see the same and continued resilience in countries, and WHO will continue to stand with countries in supporting them in this journey. So on behalf of our regional director, Dr. Moeti, who was not able to join us today, I would like again to thank you all and wishing you a good day. Thank you very much, Mary.
Thank you very much, Dr. Richard. Again, a very big thank you to you, to Professor Happy, Dr. Nixie, Dr. Balde, and all the journalists that have joined us today. Thanks everyone for the good work that we are doing with regards to this COVID-19 response. So we have come to the end of the media briefing for today, but there will be a short session for French, and Dr. Balde and Dr. Mihigo will be here to answer additional questions from French-speaking journalists. For the rest of us, thank you and do have a very nice day.
Thank you, Mary. I just wanted to tell our journalists that our next week's press conference will be on Tuesday rather than on Thursday. Thanks.
Okay, Tuesday next week is the next press media briefing rather than Thursday. Thank you, Saya, for the additional information. And over to colleagues for the French session.
Merci beaucoup et bonjour. Merci aux journalistes francophones qui restent pour cette petite session exclusivement en français. Avec nous avons toujours le docteur Richard Mihigo et le docteur Tierno Balde. La première question vient de Laurence Caramel du journal Le Monde, que je vous pose à vous, docteur Richard Mihigo. Quelle est la durée de conservation minimale des vaccins que vous recommandez aux pays donateurs? La deuxième question concerne les 2 pays qui ont utilisé seulement 10% de leur dose. De quel pays s'agit-il? À vous, docteur Mihigo.
Ok, non, merci pour cette question. En fait, la durée de conservation de vaccins varie en fait en fonction des différents produits et surtout en fonction de la température à laquelle ces produits sont stockés. Pour les vaccins, par exemple, qui utilisent la chaîne de froid ultra froide, généralement les vaccins à ARN messager, lorsqu'ils sont gardés à moins 60 ou moins 20 degrés, comme dans le cas de Moderna, ou moins 60 dans le cas du vaccin de Pfizer, lorsqu'ils ne sont pas encore décongelés, ces vaccins peuvent être conservés pendant une longue période de temps. Mais une fois qu'ils ont été retirés de la chambre ultra froide, la durée de conservation est fortement réduite et généralement c'est autour de 4 à 6 mois et c'est pourquoi les pays sont appelés à les utiliser le plus rapidement. Les autres vaccins arrivent avec une durée de vie autour de 4 à 6 mois. Et effectivement, au-delà de cette période, ces vaccins, généralement, nous ne les recommandons plus à être utilisés. Donc, c'est réellement en fonction des différents produits des vaccins qui sont conservés soit sous la chaîne ultra froide ou les autres avec la température normale entre +2 et +8 pendant une certaine période. Alors, pour les pays qui traînent un peu, comme je l'ai dit un peu, nous avons la République démocratique du Congo qui a fait un effort pour le moment, mais qui jusque-là n'a pas encore déployé les vaccins comme il faut. Le Burundi, Djibouti, le Tchad, c'est des pays qui ont eu des difficultés énormes à déployer les vaccins au début, mais avec lesquels nous travaillons pour le moment pour espérer effectivement accélérer les choses et rattraper de manière significative le retard accumulé jusque-là.
Merci, Dr Mihigo. Je me tourne maintenant vers le Dr Baldé. Ce sont des questions qui concernent le nouveau variant Omicron, des questions de Oumarou Hiro de RFI. Voici les questions. L'OMS dispose-t-elle de chiffres concernant les personnes décédées à cause de Omicron? Qu'est-ce qui peut expliquer cette rapidité de propagation de ce variant? Dr Baldé.
Merci beaucoup, Vincent, pour la question. Concernant les décès, nous n'avons pas encore vraiment des chiffres désagrégés en fonction donc, du variant, du nouveau variant, donc le Omicron. On sait qu'on est en train de le suivre avec donc, les symptômes qu'il est en train de générer. Par exemple, en Afrique du Sud, malgré un peu toute cette augmentation importante des cas, on sait que pendant les dernières 24 heures, là, il n'y a eu que 36 décès. Donc, le nombre de décès même qui est observé au niveau national en Afrique du Sud, par exemple, le pays qui concentre le plus grand nombre de cas, a baissé. Par contre, on sait que ces décès-là aussi ne sont pas nécessairement attribuables à l'Omicron. Donc, je crois qu'il est un peu tôt pour tirer donc, des conclusions, une fois de plus, quant au taux de létalité donc, du Omicron. Par contre, ce que nous n'avons pas vu, comme on le disait tout à l'heure, c'est cet afflux majeur que nous avions constaté donc, pendant le Delta, où on voyait que tous les services un peu des urgences des hôpitaux étaient quelque part donc, remplis avec des personnes avec donc, des bouteilles d'oxygène ou encore donc, des équipements qui leur permettaient donc, de respirer davantage. Ce n'est pas la même chose que nous sommes en train d'observer actuellement, mais une fois de plus, attendons de voir. On est au début de cette maladie-là, il y a eu beaucoup plus de jeunes qui sont affectés compte tenu du contexte d'éclosion de l'Omicron et peut-être beaucoup d'autres personnes âgées. Quand il y aura plus de personnes âgées, des personnes éventuellement avec plus de comorbidité, je pense qu'on pourra tirer des conclusions beaucoup plus importantes. Quant à la dangerosité un peu ou les caractéristiques particulières de l'Omicron, je pense que ça a été mentionné et répété plusieurs fois. Il s'agit donc d'un nombre important de mutations, de changements au niveau du matériel génétique donc, de ce virus-là. Le virus, il est soit fait d'ADN ou d'ARN et ces gènes-là peuvent être arrivés donc, à muter, à changer de configuration, donc entraîner quelques nouvelles caractéristiques qui peuvent donc entraîner aussi de nouvelles caractéristiques cliniques au niveau des personnes. Donc, c'est ce que nous avons observé, donc c'est ce que l'équipe de recherche en Afrique du Sud a eu à observer et merci à eux, je crois, il faut le mentionner clairement. Donc, c'est cette équipe sud-africaine-là qui a mentionné ces informations, qui les a partagées à l'ensemble de la communauté scientifique mondiale afin de pouvoir prévenir donc, cette transmission-là. Donc, c'est cette caractéristique majeure-là. Maintenant, on est en train d'étudier, d'observer l'effet de ces changements-là sur la sévérité de la maladie, sur sa transmissibilité, l'effet sur les médicaments, l'effet sur les vaccins. À vous, merci.
Merci beaucoup, Dr Baldé. Toujours à propos d'Omicron, mais cette fois-ci, à propos de l'efficacité des vaccins, Dr Mihigo, est-ce que les vaccins dont on dispose aujourd'hui protègent contre ce nouveau variant?
Il est certainement un peu tôt pour tirer des conclusions sur effectivement l'efficacité des vaccins que nous avons par rapport à Omicron. Nous allons certainement le savoir sous peu. Il y a beaucoup maintenant de recherches qui se font in vitro pour essayer exactement de voir en termes de anticorps neutralisants par rapport au Omicron, comment est-ce qu'il performe. Mais ce qui est clair, c'est qu'avec le nombre de mutations importantes qu'on a remarqué avec ce nouveau variant, il nous laisse penser qu'il y aura beaucoup de problèmes. Et mais nous ne pouvons pas dire à ce stade que le vaccin ne sera pas efficace ou la diminution de l'efficacité va être significative. Ce qui est certain, c'est que lorsqu'on regarde un pas en arrière avec les variants que nous avons connus dans le passé, le delta, le bêta à moindre degré, les vaccins actuels ont pu maintenir leur performance, surtout dans la prévention des formes graves et des formes sévères de la maladie. Alors, est-ce qu'il y aura-t-il la place pour des doses additionnelles ou les fameux boosters pour être sûr que les personnes sont protégées? C'est des choses qui, pour le moment, on est en train d'envisager sérieusement, de regarder la performance actuelle et surtout si on ajoutait des doses additionnelles, comment est-ce que les vaccins vont se comporter par rapport à ce nouveau variant. Donc, c'est des choses pour lesquelles, effectivement, nous aurons certainement très rapidement des réponses et nos recommandations vont certainement aller dans le sens que la science nous dira pour protéger le maximum de personnes.
Merci beaucoup. Et la dernière question nous vient de Myriam Edaya de Radio-Canada. Toujours pour vous, docteur Mihigo, à propos de l'inégalité d'accès aux vaccins dont on a beaucoup parlé. Qu'est-ce qu'un pays comme le Canada pourrait faire pour aider les pays africains?
Bon, vous savez, à travers le mécanisme COVAX, qui est d'ailleurs supporté par l'OMS, Gavi et CEPI, cette plateforme a été créée pour effectivement créer ou réduire les inégalités existantes qu'on imaginait déjà à l'époque, au début même de la survenue du vaccin, et qui s'est confirmé par la suite avec les pays développés, y compris le Canada, qui ont pu non seulement commander, mais stocker des vaccins plus qu'ils en ont besoin. Donc, ce que nous pensons aujourd'hui, et ça a été l'appel que nous avons lancé à tous les pays développés, mais également les organismes internationaux, de faire en sorte qu'on puisse privilégier le mécanisme COVAX, que l'excès de doses ou les donations qui se font se fassent à travers cette plateforme qui redistribue par ailleurs les vaccins au niveau des pays en développement, y compris les pays dans la région africaine. Donc, s'il y a quelque chose à faire, effectivement, c'est de travailler. Et d'ailleurs, le Canada le fait déjà. Nous avons reçu certains pays qui ont reçu des vaccins à travers le mécanisme COVAX arrivés à travers cette plateforme. Et peut-être la dernière chose qu'on pourrait demander, c'est d'éviter de prendre des mesures qui créent plus des restrictions au niveau des pays, comme on l'a vu, on l'a entendu au début de cette conférence. Et je pense que n'aide pas beaucoup, non seulement les voyages, mais surtout les approvisionnements en matière de réactifs de laboratoire, d'échanges d'informations, etc. Mais c'est surtout cette plateforme, à mon avis, qui est la plus indiquée aujourd'hui pour partager les vaccins, les thérapeutiques même, pour les pays qui en ont le plus besoin.
Merci énormément, docteur Mihigo. Merci beaucoup au docteur Baldé et merci à tous les journalistes francophones qui sont restés avec nous. Bref rappel que notre prochaine conférence de presse aura lieu mardi et non pas jeudi. Et sur ce, je vous souhaite une bonne semaine. Merci à vous.
Merci beaucoup.
Recording stopped.
Yasmina, you may end the webinar. Thank you.